Welcome to the Dialogue by Wirepoints, connecting the dots between our economy, government, and people. And now your hosts, Ted Dabrowski and Mark Glennon.
Welcome to the Dialogue by Wirepoints. This is Mark Glennon, and I'm here today with Ted Dabrowski, our president, and we're joined today by our superb, tireless research director, John Klingner. Since the start of the pandemic, we in Illinois and across the nation have been flying blind in terms of good data and good information about it. I'm not the first to say this. This is the phrase flying blind has been used by Marty Macri. He's a professor at Johns Hopkins University who has cited the many deficiencies in the data that have been coming out. Scott Gottlieb, former FDA commissioner, has also written about it. He has a book out that includes a lot about this. Criticizing the inadequate data that he says is leaving both the public and the medical community with few tools to fight it. This is a dangerous thing, not just in terms of the loss of life that we've seen from COVID, some 25,000 in Illinois, 600,000 nationally, 5 million across the world. But imagine the next one, if it's more serious, if it's a bioterror attack, for example. We need to know exactly what's going on, what's working and what isn't, in order to keep essential things like food production and all the rest going. So we're going to address the hair-pulling frustration that we've experienced ourselves in writing about the topics that we have been able to get comfortable with. And the deficiencies that we've seen in the data and why it's so important, why it has to be fixed. Ted, why don't you get us started on this?
Well, it's certainly critical that, in public policy and really in all matters, people need to know what's going on. I think as this world becomes more global, it becomes even more difficult. And, probably COVID is showing us how difficult it is to manage without data. In Illinois, for example, we have all these pension problems. Nobody really understands what's going on. Nobody really understands the impact. We have, huge crime going on. Does anybody really understand what the truth is? And it's getting really hard to figure those things out. And so, I liken this kind of COVID thing to think about every year, some 35,000 people, if I have the number right, die in car crashes. But, most people are able to make that assessment for themselves. If it's an elderly person, they have to think about whether they get on that highway or not. Everybody can kind of figure out their risks, and every day we go out there, there's a chance we die. It's a small chance, but yeah.
And that's how the medical professionals work. They are not only medical experts, but if you've been following this, you'll see that part of the roadmap is data. They got to look at the data to see what's working and what isn't, and where to put resources and where not to. John, why don't you give us an example of kind of the frustrations that you've encountered? You've been especially on the front line of this for 18 months.
Well, I just wanted to, point out that a lot of this comes down to, confidence and, how much confidence people have in the data that's being presented so they can make those rational decisions and those rational choices. For example, I'm struck by every day when I go look at the COVID data, that on the main page of the IDPH website, they show the COVID-19 community transmission map. And if you look at it, it's just a picture of Illinois, and of all the counties, all but 3 of them are just labeled solid red, high transmission. How is anybody supposed to make an informed decision about what they should do about COVID when there's no differentiation across the entire state of Illinois? And
that's a frustration for you, putting many, many hours. You can imagine what it's like for an average person, especially people who are at risk, the elderly. And there have been surveys about this too. Franklin Templeton, the financial firm, did a big national survey on this, and they concluded that America is blinded from science. That was their phrase. This was done fairly early in the pandemic last summer, but at the time, people had no idea that the special risk was to older people, no idea what the death rates are or anything else. So this is a problem both for the individual choices that we have to make, which are too few in our opinion, but for the policymakers as well. Let's go through some of the specifics, and we'll try to answer some of the questions along the way, because we get one of our most popular pages on our site that has many tens of thousands of views is the simple data that we put up in chart form that comes from the authorities. It's on our site, wirepoints.org. But we get questions quite often, particularly about comorbidities. I mean, Ted, tell us what our experience was and how we had to wrestle with that initially.
Yeah, I mean, the big questions was who was dying, and were these people really healthy people, or were they people that had other big problems? And we knew from what was coming from Europe that most of the people were sick with some other sicknesses, whether it was obesity or hypertension. So we tried to get the data, and we couldn't. And you could go onto New York's website early on, and they had every person. They had a whole list of data and what the comorbidities were, and that nearly 90% of those people were comorbid. You couldn't get anything in Illinois. We FOIA'd for it, and they said no. And so only when we went into the examiners, the Cook County medical examiners' data, did we find some data, and we cut it up ourselves and put the data out there. But it was impossible to find, and the government wasn't going to share it, even though other states were. And it's the kind of thing that helps people understand what the risks are. And should you be super careful, less careful, or you deem your own risk, you calculate your own risk, and people just couldn't do that.
Yeah, John, we had a big frustration initially because the state wasn't even collecting data on hospitalizations, which is a far better indicator. Everybody finally concluded in terms of the severity and trends in the disease. What's the latest on what kind of hospitalization information we get?
Well, from the IDPH, they do provide the daily count of people in the hospital by day now, and they've been doing that for a while. But like you said, only after we raised the point that it's kind of one of the more important metrics to have. But now with the rise of the Delta variant and how this pandemic has progressed, it's super important to know not just how many people are hospitalized, but the demographics of the people that are hospitalized now, and that's something that we simply can't get from the IDPH. I FOIA'd several times for a breakdown of the count of daily COVID patients who are hospitalized by their age and by their race. Same thing for the other hospitalization stat that matters. Admissions, daily admissions to the hospitals, and it's just something that they cannot give or will not give. So we have no idea what the breakdown for hospitalizations is, and that's frustrating.
Yeah. Initially,
we know nothing.
Just
to add there, we know nothing about discharges either. So, we know people are in the hospital, but we don't know anything about admissions. We know some things now, but for a long time we didn't, and we know nothing about discharges. So it's really hard to figure out who's in, who's out, and why, and how fast.
Yeah, and this goes not just for Illinois, but for the CDC, both under the Trump administration and the Biden administration. This data has been a problem, so we're really not being partisan here. Particularly on hospitalizations, this isn't that hard to collect. A senior nurse at one of the hospitals told me, every morning we have what we call the huddle. The first thing we have to do meticulously is measure who's in the hospital, how many are coming in, so we know if we have enough staffing and resources and all the rest, what they're there for. And, to fill out a little electronic document, to send that in, check off some boxes, shouldn't be that difficult. By the way, she told me that they're not doing that regularly anymore, so I kind of wonder about the accuracy of the numbers coming out. I don't know if her hospital is typical. I would love to know. Masks are another obviously very controversial issue. I don't know for sure what the final answer is. I think the experts seem to agree that the best study that has come out is a recent one in Bangladesh. It was huge with hundreds of thousands of participants. They concluded that surgical masks are fairly effective, reduced transmissions by 11%. That sounds small, but that's meaningful. They also, by the way, found no effect of cloth masks, which are very commonly worn. But that kind of data is important to people. I personally worry that there's over-reliance on masks for the elderly. You go into Walgreens or a grocery store and you see senior people in their 80s with masks. They think they're safe. Well, an 11% reduction might not be sufficient for them. That's just one example of the kind of personal decision that's being impacted and jeopardized by this kind of bad data. John, another big one has been the demographics, the age group of people who have been affected by this. Would you tell us what we've experienced there?
Well, the big thing with that was, of course, the first of all, closing down all the schools with those mandates, and then, of course, now you have the more recent mask mandate coming in, from the state and imposed on all, public and private schools, regardless of, their, the spread of COVID in their communities. And so, we wanted to see, how are those places actually being impacted? What's actually happening with children? Because that's ostensibly what that mandate is about. It's all. So, following that, it becomes incredibly difficult because, no matter how many times I try to phrase the question with them, they, won't give it to us. I've, trying to get a breakdown of, again, hospitalizations, the comorbidities among youth. It's, if it wasn't for the Cook County data, I wouldn't be able to, figure out any of that at all. Once again, I want to point out that it all comes down to their rules on, they say it all comes down to privacy, that they can't release, any data that allow you to, identify, the people that are in the hospital and that sort of thing. But I find that, very hard to, to line up with the fact that there's the Cook County medical examiner who is releasing, everything but a name about the people that have died in Cook County. That
Sure.
Why is it
Sure.
why is it that they can provide something like that and yet we can't get data on hospitalization and death statewide? It's
Sure.
very frustrating.
And there's no excuse for many of the other topics. One that we've written about all these things, by the way. If you go to wirepoints.org, we got a search button there. You can find not articles not only by us, but from any reputable source that pertains to Illinois on these things. But one of the topics that's been suppressed clearly is the importance of treatments as opposed to vaccines. Regeneron, for example, is one of the monoclonal antibody treatments. Well, they've known for 11 months that this is very effective. It's reduces by 70%, the likelihood that you will be hospitalized if you're infected, as long as you get treated promptly. Well, this is something people ought to know, but it just hasn't been talked about. We're going to talk about the suppression issue a little bit more. Some of this has come down to, absolutely, simple untruths, lies, frankly, and that's not an overstatement. There are liberal sources that I have identified as Axios has written about this. Several articles have come out. It's not just Mr. Fauci who changed the story on masking, but he also changed the story on the target that we have to get to herd immunity, which is potentially a kind of a solution for this. He gradually increased the target number from 70 to 85% without any explanation. He basically admitted too that he was doing it initially as sort of a white lie, a noble lie. Well, that's not what people want to hear. They need to make these decisions for themselves, and they need to. The authorities have to have credibility, and they're not going to get away with white lies. The VAERS database, I'm sure both of you are familiar with that supposedly collects information about bad effects from the vaccines. Tell us about that if one of you has followed that. We know that it's incomplete. The experts themselves complain that that people don't make entries. You can't really rely on it, but that's all we got is that VAERS system, as it's called, and we've got great difficulty trying to establish what, if any, bad side effects there are from these vaccines.
Well, yeah, a lot of people try to use some of that data to complain or their concerns about the vaccine, and yet when people use that data, they get poo-pooed on. So I'm really confused about that data. I haven't used it yet, John. I don't think you have either. We tried to look at it, we tried to analyze it, and there's a massive list of impacts from the vaccines, but we haven't gotten comfortable yet on exactly the vetting of that data. I think it's vetted, but I don't know, and so therefore we haven't grabbed onto it yet.
Another big one is the lack of information on breakthroughs. That there's two parts to this. How many people that get vaccinated get sick nevertheless? Well, Illinois has finally started to put up some numbers on that. We're going to add that to our daily information. But John, tell us what happens if you try to figure out how many people who have natural immunity, that is, they've had the disease already, they have antibodies. How often is there a breakthrough there?
Well, the problem is we don't know. What the IDPH has started to provide is deaths and hospitalizations, on a cumulative basis by week over time, and that's a little bit helpful and to help you tell how things are going on. But in terms of some of the more important, the more important data to really drill down to know, as a person, your actual risk level, depending on whether you're elderly or young or you've got comorbidities or something like that. They're not providing it. It's kind of funny, actually. I FOIA'd for this because it was coming down the pike. I knew that the idea of breakthroughs and all the rest of it. So I actually asked IDPH in early September. I submitted a FOIA and asked for, can you give me, people who are hospitalized by vaccination status? And they sent back a very short reply that says, we're not collecting that. Lo and behold, now we're in October, and their site now has, hospitalizations over time. So,
and there's nothing, they put up nothing on natural immunity, which is one of the most controversial topics, because the people who are objecting most to having any kind of vaccine mandate at their employer or anywhere else are those who have already had a disease, and they think, why should I take the risk? I've already got natural immunity. There are studies, particularly one in Israel, that found that natural immunity provides 13 times more effectiveness against reinfection than a vaccine does. But we really don't have any information here on how many people that have had natural immunity or had a prior infection are getting sick again. In the meantime, the authorities try to encourage those people as well to get vaccine. They're mandating it in the case of some state workers, and many companies are doing it. Well, why? If they don't even have the data to make the mandate make any sense. So no wonder people are revolting about this kind of thing. And it doesn't help, by the way, that when the President of the United States says we need to get to 90% vaccination rate. That's just never going to happen. He was ridiculed for that, but he just out of the loop on that. It's not ever going to be achievable.
Hey, Mark, that's one of the areas that I've heard some of the more distinguished people who study this stuff talk about. They say that the biggest opportunity, and probably the one thing that's not being studied, is a natural immunity across the globe. You think about how many people have had this already, including kids, right? Where we don't know how many kids have had it because most of them are asymptomatic. So the question is, what is the power of natural immunity, and what can we learn from it across the globe? I mean, think about the availability of data and the number of studies that could be done. And they said that there's really no concerted effort by let's call them the officials across the world, to gather that data and properly lay it out for people to understand.
This whole topic of natural immunity was one that was clearly suppressed deliberately by both national and state authorities. They just didn't talk about it. Fauci has kind of admitted that recently, by the way. But there's a way to test it too. You can go out and do antibody testing. It's called serology testing, and you don't have to test everybody in the state. You just do a random sample to find out how many people have antibodies, that many of whom didn't even know they had the disease early. But Pritzker expressly refused to even do that. He never collected the data on it. And that's been true across the country. They focused on vaccines and masks, and hell or high water, that's what they were going to talk about, and everything else got pushed aside. Another point that is incredibly frustrating is the arrogance and hubris that comes out of the mouths of many supposed experts that simply don't reflect basic data. The most recent example would be the claim that Pritzker's most recent mandates on mask use and vaccination led to the drop in recent COVIDs and to a big increase in vaccinations. One of the local news sources had a story to that effect. Pritzker's office, of course, picked it up and spread it around. The news source quoted some epidemiologists saying that, well, it's just flatly untrue. It contradicts the published data from the Illinois Department of Public Health. After Pritzker made that announcement about the mandates, vaccinations ticked up a little bit for a couple days, but they plummeted after that and have continued to plummet. Cases have gone down, but they've come down here and across the nation in at least the same ratios, even in states where there's no mandates, such as Florida and Texas. And when you get into the projections, boy, then you'll really get frustrated. You might remember early that the widely cited projections came from the University of Washington. They turned out to be just ridiculously inaccurate. Pritzker likewise trotted out his new projections and introduced his experts in April of 2020. The projections were wrong before he even announced them. A turn that had been predicted had already taken place several weeks before they published those projections. So if you're going to rely on experts, and you have to on many of these issues, you better pick them very carefully. Ted?
I remember when we were trying to use that University of Washington data, and every day we were looking at it, and every day the numbers would just flip dramatically to where we couldn't make sense of it, and we started getting uncomfortable at publishing what they were doing because they were changing so much. And and this is the issue with I think there are no experts right now. There are many experts, or it's got to be a community of data that comes together over time. For one group to claim they know everything is just flat out, whatever you want to call it, false or who cares? It's bad. And we heard, I think over the weekend, New Zealand claiming that their government would be the experts and they had the truth on COVID and nobody else does. And this is really dangerous. And we see this all the time. The data changes, it flips. We're not sure. What we need to do is need to be smart about the data and not listen to one expert, but to have the experts all work together to keep coming up with new research challenges, right? They should challenge the heck out of each other because this stuff changes.
That's how science is supposed to work. Let's turn to that. How has this been allowed to happen? Why are even experts like Gottlieb Macri, people like us, simply trying to digest the data? How is it possible that we could have become so frustrated and found so many inconsistencies in their own numbers, omissions of data that's clearly needed? Let's go around the horn on this. John, what's your explanation for how America has allowed this to happen?
I just think in general, I don't think anybody expected anything like this. And if there's one thing we know about bureaucracy, it's that it moves slowly and is incredibly inefficient. When I've originally tried to get stuff for the CDC, and I still do, their data center is just a mess. The stuff you want to find, if you want to actually download the data for some of the stuff they have on their supposedly public COVID dashboard, you can't actually get a hold of it that way. You can't even, select and download the data there. You have to go to another site and search through a whole bunch of, unrelated Excels in order to get what you're looking for. And that's just how this works. It's a bunch of, unrelated people, unable to actually come together and create a cohesive product. And so that's how it just turns into a muddle.
Yeah, and CDC has changed the data on very basic things frequently without any good explanation. For example, today, that question about how many people have natural immunity, the CDC site says it's about a third of the population. Well, back in January, the direct implication that you could draw from their data was well over half the population. Again, that's 9 months ago. You simply take the number of reported cases times their multiple of the number of actual cases that they said there were for each reported case, and you get the number of actual infections and adjust it. Some people get infected, but they don't produce antibodies. So they were downplaying that issue at the time, and they just changed their story willy-nilly with no explanation.
Well, I think one of the big things, Mark, that it's hard, and I think John's absolutely right. John, what's your quote about government and malice versus incompetence?
Oh gosh, which law is it? I just know it's I believe to paraphrase, it's simply never attribute to malice what you can more easily attribute to stupidity.
Right, and so I think there's a lot of that in government, but at the same time, we're hitting a new time in this global information age where information is power, and there's big battles over who has that information, who controls it, and then who gets to make the decisions. And I saw this when I worked at Citibank. Whoever had all that data, in our global data, they were the ones that made a lot of the big decisions. So here we are. I think our institutions are losing trust, and people are fighting back. And so the institutions are then therefore trying to hang on to the data, trying to hang on to the information to leverage their power. When the opposite should be happening right now. This kind of data should be, if you think about it from a pure, think of it like the software that's source code. There should be a business orientation where you're just releasing all the data, make it as available as possible. Don't be territorial about it, and let the best people analyze it, crunch it, bring it together, and come up with the best solutions. But that's not the world we live in. And you're finding this battle between people who know instinctively that they're not being told everything or the truth, or that their governments are incompetent, whichever one you want, and governments and institutions that are trying to hold on to power and claim they know everything because they're too embarrassed to say they just don't know.
Yeah, I'd certainly say some of it is pure ineptitude. Some of it is their attempt at a noble lie. Again, it's pretty clear that they wanted to bank on vaccines and masks as the solution. And by the way, another one is Pritzker went to Congress, as you remember, last July 2020, and testified. There was a big downturn in cases at the time in Illinois. Well, I know how to solve it because of my mask mandate. That other states should be copying me because that's what works. Well, it turned out not to be true. Everybody's data changed afterwards. There's no correlation to the mask mandate. But he got away with it and got a lot of headlines. So there are white lies. There's ineptitude, but there was also a fundamental lack of structure going into this. The purpose of the Centers for Disease Control and the CDC should be to set up to deal with this stuff. But as this pandemic took hold, it was very apparent that they hadn't worked out who's going to collect what data, who's responsible for conducting what studies. That's what, by the way, McCary and Gottlieb are most irritated about, that basic studies on some of the things that we should have answers to haven't even been undertaken. But they didn't have that worked out, and that's got to be resolved still for this pandemic, but especially for the next one. They got to have a division of responsibilities between state and local authorities about this. Just one example, again, is that collection of hospitalization data. When they finally decided that was important to collect, both the federal government and the state started sending these questionnaires to hospitals to collect those daily numbers. Well, why duplicate efforts that way and make the reporting consistent? It's just been a hodgepodge, make it up as you go along kind of system, and that's got to be fixed.
Yeah, I was in Citibank during the Y2K stuff, and if you understood how much time and how much effort we put into preparing for a Y2K scenario, and we spent all these. We just pretended like it happened. We had all these backup plans, and it was phenomenal how much work we did. You would think that the CDC, we've been talking about this. We've had movies on this stuff of some kind of contagious thing happening. You would think that they would have had a lot of this stuff like, hey, we're going to collect the hospital data. We're going to be able to share this information. You would have thought that they were, so quick to do it because, they could have done their Y2Ks 1,000 times over.
Yeah.
Right. I find it fascinating that in this case it's especially when once again coming back to the youth deaths and information about kids and all the rest of that but the CDC, thanks to the their privacy concerns, et cetera, that you can't get a drill down of the number of kids who have died over time in states. it's just not available. You can get a total, but any breakdown than that, and it's just not available to the public, which you think would be a huge thing that people would want to know. I find it funny that Ted and I, researching this, had to go to someplace, a nonprofit, a private organization like the American Academy of Pediatrics is collecting its own data on kids, and that's what we've had to look at because it's just not available on the CDC.
Right, and it's not even full, right? It's not the whole data.
And even that's not even full, but it's the best that we've got. And a year and a half into it, that's the best that we've got. It just seems ridiculous to me.
It's not 1919 anymore. Back in the Spanish flu epidemic, the government of most Western countries, Spanish flu epidemic, they made a concerted effort to suppress the news about how bad it was to try to help the World War I effort. This was 1916, I guess, when it started. And they were able to get away with it, except Spain, interestingly. They weren't a combatant in the war, so their reporters were covering it, and that's why we call it the Spanish flu. But they seem to think that they can get away with fooling the public still, and that the public's not going to ask questions. That just doesn't work anymore in the internet age. Their credibility is shot now, and they've got to restore it, and it's got to be earned. And Ted, I totally with you. The way they got to earn it back is just by laying it out. The principle of compliance, getting vaccinations, masks, whatever you think is going to work is informed consent. That's a historic document, doctrine in medical ethics that they've thrown away too. We'll have to wrap it up for now on Wirepoints, but check out our website. We'll stay on top of these issues and continue to research them as best we can.